I've made a tiny little incision, which literally is about 2 millimeters behind the chin line, so it's going to be essentially invisible. From that very little tiny incision, I slip a little catheter under the skin, and it's connected to an IV bag which has lots of local anesthetic in it. For the submental or the neck area, I need to infiltrate very, very little of that bag, maybe 50 cc's. And what it does, it doesn't hurt at all, but it'll make the area completely numb. It'll also make them look quite swollen, and this will go away. The next step is I'm inserting the fiber optic laser fiber, and that's what you're seeing here. It's connected to a very expensive laser box, and every time I step on the pedal, 2 different wavelengths of laser beams are coming through it, and I move it back and forth so that the heat is spread evenly. You can actually see the light through the skin sometimes, and what I'm demonstrating is the guide light. There's a little light that comes out, and I've done hundreds. In fact, I've almost done 600 of these type cases. So I do it essentially by feel. The machine keeps track of how many pulses I've given and how much energy has been given. So I use that as a guideline, but I have a lot of personal experience doing this. The patient's comfortable. Even though we don't have sound on from the OR, she's actually chatting with me. I usually play music. So it's a very relaxed environment, and she's very, very comfortable. The drapes are sterile. And the environment sterile. The next step that you see is I've removed the smart lipo cannula, and I use a very tiny liposuction cannula for the neck area. There's very little fat in the neck area, but I do remove some, and although it's a small amount, it's enough to make a big difference. This is connecting the liposuction machine up to the cannula. And then I'll suck out a little bit of fat. Then I put 1 dissolving suture in. We'll put a little stair strip, which is essentially glorified Scotch tape, and the patient's done. We put a neck garment that will wrap around her head, and that gives some compression to the submental area. I tell them to wear it that day until they go to work the next day. They can shower the next morning. I like them usually to wear the neck garment for 4 to 6 weeks after surgery, but again, only at night or only if they're at home by themselves. They're not to wear it to restaurants or over to friends' house. So I make it very easy for them to live with and not get in the way of their lifestyle. They can start exercising and go back to the gym the next day, but they can shower they can go back to the gym in 5 days' time and start exercising as hard as they want, but they can definitely shower the next day and go back to work.